Hello, everyone, and welcome. My name is Era Singleton. I am the CEO of Thank God It's Natural and the Associate Director of the TGIN Foundation. I am so excited to be here today, and thank you all so much for joining. As we welcome our panelists, this webinar is really to educate you all on breast cancer and breast health awareness. So I'm so excited to introduce Dr. Piper and our panelists and to get started. Dr. Piper.
Good afternoon. My name is Dr. Piper Farrell. I am Chief Operating Officer of TGIN and Executive Director of the TGIN Foundation.
And Dr. Piper, could you just briefly tell us Chris-Tia's story, what this means to you to be here with the Lurie cancer?
Yes, so Chris-Tia was my sister, and in 2015, she was diagnosed with breast cancer. And she fought courageously. Unfortunately, she lost her battle in November of 2021. But throughout her battle, she realized and recognized the disparities between underinsured and uninsured women of color, particularly financial disparities. Chris-Tia was a Harvard-trained lawyer, and so she had the resources to choose the hospital she wanted to go to. Financial implications really weren't a burden to her, but we know that some women have to pay for childcare. There are healthier food choices that they want to make, parking and transportation for appointments. So the financial implications can really be a burden to someone going through breast cancer treatment, and they're limited in their finances. So Chris-Tia's vision was to alleviate some of those financial burdens for women going through breast cancer treatment. And so the TGIN Foundation was birthed out of her vision for wanting to help those women.
Thank you. And I just wanted to say this collaboration with the Lurie Cancer Center and the TGIN Foundation means so much to me and Dr. Piper. I personally would go with Chris-Tia to her breast health and different appointments and would sit in that lobby with her. So I just really want to extend a warm thank you to the Lurie Cancer Center, one, for this opportunity and for making Chris-Tia's journey, though it was a scary one, a little bit more easier to go through. So thank you so much. So now I'm going to introduce our presenters, and our presenters will be discussing the importance of family history and genetic counseling in minority populations specifically. We will also celebrate the legacy of my aunt, Chris-Tia Donaldson, and her mission to reduce disparities in breast cancer in women of color. So without further ado, I am going to introduce Deb and Pam. Deb Duquette is a board-certified genetic counselor with 30 years of experience and nationally recognized as a leader in public health genomics, precision public health. She is the director of the graduate program in genetic counseling and associate professor at Northwestern University Feinberg School of Medicine. She also recently became an academic expert to the Centers for Disease Control and Prevention, the CDC, Division of Cancer Prevention and Control. She has created and implemented multiple public health genomics programs to increase appropriate genetic counseling and testing referrals for individuals from diverse and disparate populations. This includes successfully working with health plans, including Medicare and Medicaid plans, to increase the number of written policies for appropriate genetic counseling, testing, and management for individuals at risk for hereditary cancer conditions, drastically increasing appropriate referrals and receipt of cancer genetic counseling and testing in the state and for specific target populations, low income, and uninsured, underinsured women identified at high risk at local family planning clinics and breast and cervical cancer control navigation program clinics. She has authored several peer-reviewed articles on cancer genomics, sudden cardiac death of the young, and other public health genomics topics. Deb has also been appointed and serves on the multiple state and national committees. Welcome, Deb. And now I will introduce Dr. Pamela Ganschow, is the Director of Cancer Prevention and Survivorship Clinical Programs at the University of Illinois Cancer Center and Associate Professor of Clinical Medicine at the University of Illinois, Chicago. She is an on-code generalist, a primary care physician whose clinical care and research focuses primarily on cancer along the continuum of care from prevention and screening through diagnosis and survivorship. She has dedicated her professional life to work in cancer prevention and control, building precision prevention initiatives that enable high-quality access to cancer screening, risk management, and genetic testing services for underserved populations. She is also a 23-year veteran of Cook County Health, during which she secured several $1 million in grant funding to enhance training programs and implement interventions that improve access to and quality of cancer care. In addition to clinical care and research, she also enjoys teaching colleagues and mentoring medical students, residents, and fellows. Please welcome.
Thank you. Thank you so much for the warm introductions. I'm really excited to be here today to do this presentation with Deb. We've worked in the cancer genetics space for a long time together, and this is our first time presenting together. We have an exciting presentation for you with some polls that will be happening through our presentation. So I'll encourage you when you see those pop up to take those, and I'll share the results with you as we go through this presentation, but hoping to make this really engaging and to raise awareness about genetic testing. So the title of our talk is Why Cancer Shouldn't Be a Family Secret Anymore. And I think this is really important. I think, you know, one of my favorite patient advocates out there, Candace Henley, has coined the term family secrets kill. And I think what we hope to do today is to help everyone here understand why it's important to know your family history and how genetic testing can help you understand your risk for cancer, breast and other cancers. So there we go. Okay. So really just why we're here today, we're going to provide a lot of facts about breast cancer, about hereditary cancer syndromes, and really try to dispel some myths about cancer genetics and genetic testing. As you've heard Chris-Tia's story, we're here to also share some personal stories. I'm really excited to have Tasha here, one of our patients, to share her story after we're done with our presentation and help bring this kind of full circle to how this, you know, impacts care and impacts patient care, impacts lives. And then we'll also be sharing some resources with you around genetic testing, because this may be new. This may be something you've never heard about, or maybe you've heard about and you don't know that much about and you want to learn more. And, you know, we only have 30 minutes to talk to you today. I think both of us could talk to you for hours about this. So really, if you want to learn more, we'll share some resources at the end. So I want to just start out with just talking about, you know, how we've been screening for cancer in the past and sort of how we're shifting that paradigm and thinking about cancer screening kind of going forward and where we're headed. You know, the traditional approach to cancer screening has kind of been a one size fits all. Like you hit a certain age, and you should start screening at, you know, standard intervals. And we've sort of applied that to everybody. And I think that the way that this is shifting now is to have a more personalized approach, to identify risk factors in patients, to understand if they might be at higher risk for certain types of cancer, and then modifying that risk management plan and personalizing that risk management and that screening plan to address those risk factors, whether that means starting earlier or doing them more frequently, or looking at alternative ways to do that screening for patients who are at higher risk for certain types of cancer. And one of the ways that we do that is by identifying risk factors. And there's many risk factors for a variety of of different cancers. But family history is kind of a common theme across most cancers, not all cancers, like cervical cancer is primarily due to a virus, but cancers like breast and colon and ovarian, one of the biggest risk factors for those cancers is family history in addition to age. And so it's really important to know that family history and to understand and identify who's at the highest risk of certain types of cancers so that we can start screening those patients earlier and potentially more frequently, as I mentioned, with possibly with alternative screening modalities. And so that's kind of the shift, is moving from that one size fits all, start at a certain age, to personalizing that approach based on your family history and other risk factors. So this is something you should be talking with your doctors about. Like, should I be starting breast cancer screening, in my 40s, or do I need to start earlier, or can I wait till 50? So it's really, I think, a conversation to have with your physician and a sort of a different approach to thinking about this, and not just one cancer, but all of the cancers that you may be at risk for. So now we're going to stop. We're going to do our first poll and make this engaging. And so you're going to see that come up on the screen. But one of the things that I wanted to find out from the audience here is how familiar you are with genetic testing for hereditary cancer risk before we get started. So you can see the poll here. I'm going to give you just a minute to answer your poll, and then I'm going to share the results and we'll move on. So are you not at all familiar with it? Are you somewhat familiar, or are you very familiar with it? And this will really help guide how much information and the types of information we give you today. So please take a minute to fill that out. Tarnika, I think we should have some music playing. All right. So, okay, wow, this is impressive. Okay, so the majority of you said that you were either somewhat familiar or very familiar with it, which I think, if we gave this talk 5 years ago, I think the numbers would be really different, right? I think there's really been an increased awareness. So this is such a great poll to see that. I think that, people are becoming a lot more familiar and a lot more aware of genetic testing. So good. Well, I think it's important before we kind of dive into this for everybody, irrespective of your knowledge of hereditary cancer and genetic testing, to just give some basic definitions of genetics, because for some people it may seem like a scientific term, and genetics can really be complicated. But some of the terms that we're going to be using today, is a simple definition of genetics, right? So the study of how traits are passed down from parents to children through the generation and through genes. This is, including like traits like physical features, health, wellness, and how your body functions, and risk for diseases are all passed down from parents to biologic children from generation to generation. The image on the right here is called a pedigree. This is a diagram that doctors can use to help track diseases through generations in a family. And the basic building blocks for genetics are DNA and genes. Some additional words that may come up today are inherited mutations. So I've sort of mentioned hereditary cancer and inherited mutations. So inherited mutations, these are changes in those genes that really can be passed down from parents to children. And some inherited mutations can increase people's risk for diseases such as cancer. The other term that we'll use a lot today is hereditary cancer. And these, when we talk about this, we're talking about cancers that are caused by these inherited mutations, and we refer to those as hereditary cancers. Okay, so now that we've got, those definitions out there, what I also want to just remind everybody, while we're going to talk about hereditary cancer today, that cancer is a common disease, and most cancers are not hereditary. As I defined in the previous slide, the term hereditary cancer, again, is used to describe cancers that are caused by a gene change or a mutation that a patient inherits from their parent. But only 10% of all cancers are considered hereditary. The remaining 90% of all cancers are considered sporadic, and different mutations in different genes can cause different types of cancers to run in families. I think it's important to note that many, but not all, mutations can also lead to younger onset cancers, such as breast and colon cancers, among people as early as in their 20s, 30s, and 40s. So what we're going to focus the rest of the talk on is this smaller but important subset of hereditary cancers and how family history plays a role in helping us identify people who are at risk for these types of cancer. But before we dig into this more deeply, I want to talk specifically about another important risk factor that impacts breast cancer outcomes, and that's race and ethnicity. In the United States, breast cancer is really the most common cancer and the second leading cause of death in the US in terms of cancer. And actually worldwide, it is now becoming the leading cause of death. While there's been a 40% decline in breast cancer deaths over the last 30 years, thanks to increased awareness through events like this, I mean, you saw in the poll, we're really raising awareness about, breast cancers, hereditary cancers, and cancer in general. But also, advances in screening and treatment. Unfortunately, there continues to be a significant difference in the outcomes between racial and ethnic groups in the US. So as you can see here in this graph of breast cancer incidence in the US, and what I mean by incidence is how many breast cancers are diagnosed, or the rate of diagnosis. And this is represented in the light pink bars. And you can see that breast cancer rates are highest in white and Black populations, the two tall bars on the left. And actually more recent data suggests that they're almost equal now. But the disturbing part is when you look at the darker pink, the shorter bars below the light pink bars, you can see that the mortality rates, or the rates of people dying from breast cancer, are significantly higher for African American women. In addition, while the incidence of breast cancer is lower in Latina populations, sort of over the far right bar, it's still the leading cause of death in these populations. And Latina women, like African American women, are more likely to be diagnosed at younger ages. They're more likely to have more aggressive tumors and later stages of the disease. So the burden is really high. Here, I'm just going to also point out that Chicago really has a problem with racial disparities in breast cancer mortality that several other major cities in the US, like New York City, do not. Although we're not the worst, we still have a lot of work to do. As you can see here on the graph on the left in the first two bars, Chicago has a higher overall breast cancer mortality than the average breast cancer death rate or mortality rate in the United States. When we break that down by race over the next three bars to the right, this shows that the excess mortality is due to the significantly higher death rates among Black women with breast cancer. They're almost 50% higher than white women in Chicago. On the right is a map of the mortality rates in Cook County, showing the clustering of the higher mortality rates in some of the most disadvantaged neighborhoods on the west and the south sides, where poverty often prevails. The reasons for this are complex, but clearly it's not just genetics. Access to timely and high-quality screening, prevention and treatment, lifestyle factors, and social determinants really play a big role in breast cancer outcomes and in overall health because they impact nearly every aspect of care. The differences seen in this map of Cook County suggests that not all neighborhoods have benefited equally from the advancements that we've made in screening and treatment. But bringing us back again to hereditary cancer, while these differences are not all due to genetics, what we do know is that compared to white people, racial minorities are equally likely to have these inherited mutations that we're going to talk about that are linked to cancer. But unfortunately, minority groups are much less likely to be referred by their doctor for genetic testing. And so I think we really have a lot of opportunities to promote health equity through equitable access to genetic testing and understanding what that road looks like. We need to overcome well-established hurdles along the way for populations at greatest risk of being left out. And these populations include those living in rural settings, those with disabilities, or racial and ethnic minorities, and those who are under and uninsured. And the well-known hurdles that we need to overcome in these populations include things like education and awareness, discrimination and bias, accessibility of services, and cost. And today we're really focused on overcoming the hurdle of education and awareness, which I think we're overcoming as shown by that poll we took earlier, but really bringing education and awareness to the importance of family history, genetic counseling, and genetic testing. And so now I'm going to turn it over to Deb, who's going to tell you more about what this involves.
Thank you so much, Dr. Ganchow. Also, a huge thank you to Thank God It's Natural for today's webinar. And thank you to all of you for joining today as well. As mentioned, I am a board certified genetic counselor and the director of the graduate program in genetic counseling at Northwestern University, and have the honor of training the future generation of genetic counselors. And I want to tell you a bit more about genetic counseling and genetic testing and current evidence-based recommendations from experts are that people that are considering cancer genetic testing should see a genetic counselor. And genetic counselors, for those that are not aware, are trained experts with a master's degree in genetic counseling. And the specific cancer genetic counseling process helps people to understand and adapt to the medical, psychological, and family implications of hereditary cancers. Genetic counseling includes collecting family and medical history to assess the chances of diseases like cancer. It also includes education about inheritance, genetic testing, cancer prevention, cancer resources, as well as research. And also, cancer genetic counseling promotes informed choices. Pam, could you do the next slide, change to? Thank you so much. Two common genes linked to breast cancer are known as BRCA1 and BRCA2. These are two separate genes that increase the risk for breast cancer, ovarian cancer, pancreatic cancer, and prostate cancer. And we know that about 1 in 400 people in the United States have an inherited mutation in one of these genes. BRCA1 and BRCA2 can cause cancers to run in families, and they can cause cancers to happen at a younger age. There are other genes that have also been linked to risks for cancers. Most are less common than BRCA1 and BRCA2. And on the right side of this slide is a list of some of the other genes that may cause a higher chance for breast cancer as well as other cancers. These different genes also come with different cancer risks. And we also do know that the vast majority of people that have one of these specific genes are not aware of that information. Recent estimates are approximately 80% of people who have one of these specific important genes are not aware of that today. So what I'd like to do is to try to do another poll here. Let's see how this works. So please, for this poll, answer true or false that genetic testing is only helpful for people with a lot of cancer in their family. True or false? So 90% of you have said that the answer to that was false. So that is wonderful. Once again, I think this is a reflection of the people that are joining today that are very familiar with hereditary cancers. This statement is false, that while genetic testing is helpful for people with a lot of cancer in their family, it can also be beneficial for people who do not have a lot of cancer in their family. In some cases, rare cancers and cancers in young people can be enough to recommend genetic testing. Next slide, please. Importantly, both males and females can inherit a BRCA1 or BRCA2 mutation. However, the types and risks of cancer do differ. This slide highlights an incredible hereditary breast cancer advocate whose name is Angel Moses. Angel is a volunteer for an advocacy group called Facing Our Risk of Cancer Empowered, or FORCE. She is a breast cancer survivor with a BRCA2 mutation. Her father was recently diagnosed with aggressive prostate cancer. She told his doctors this information about her own mutation and encouraged them to test her dad for the same mutation. The doctors incorrectly told her that testing was not needed since these mutations don't affect men. Please know that this is not true. These inherited mutations affect both males and females. Next slide, please. In 2020, Matt Knowles, who is Beyonce's father, announced that he was diagnosed with breast cancer. He then had genetic testing and was found to have a BRCA2 mutation. Although breast cancer in men is rare, if you have a family member who is male with breast cancer, this alone would be a reason to see a genetic counselor and consider genetic testing. Next slide, please. Like having a male family member with breast cancer, there are other types of cancer in which even one person in the family can be enough to recommend genetic counseling and testing. Examples would include a family member who has ovarian cancer, a family member who has pancreatic cancer, or an aggressive prostate cancer, or a family member who has had multiple breast cancers, or a family member who has had a triple negative breast cancer, or a young breast cancer. And by young breast cancer, we mean a person that was found to have breast cancer at 50 years of age or younger. Next slide, please. Referral for genetic counseling and testing can be beneficial at any time, such as at the time of a new cancer diagnosis or as a long-term cancer survivor. It can also be especially important for people to consider who have not yet had cancer, but have a family history of cancer or have a known hereditary gene mutation within their family. Next slide, please. For those that are referred and appropriate for genetic counseling can be done in person or remotely through telemedicine. The genetic counseling session process helps people to consider the risks, benefits, and limitations of hereditary cancer genetic testing. And although genetic testing may not be right for everyone, there are many benefits in being tested, and knowing if you have an inherited mutation can provide information about cancer in the family, personal cancer risks to relatives, and it can personally help guide decisions about appropriate cancer screening, cancer risk reduction, and cancer treatment. Importantly, there are new targeted therapies that may be even more effective and have fewer side effects for those that have hereditary cancers. Also, we know that hereditary cancer genetic testing can also help with decisions with fertility as well as childbearing. Next slide, please. For those that decide to have a hereditary cancer genetic test, obtaining a sample for that testing can be done by a simple blood test, or it can even involve something called a cheek swab. Genetic testing can be done in a clinic or by a cheek swab even at your home and then mailed to a genetic testing lab. Importantly, hereditary cancer genetic testing for health purposes should always be done in coordination with your healthcare provider or a genetic counselor. And please know that we will be giving a bit more information about how to find your local genetic counselor at the end of the presentation today. Next slide, please. There are also tests that are marketed directly to consumers without the involvement of a healthcare provider. These are called direct-to-consumer tests. Most direct-to-consumer tests are done for non-medical purposes, such as finding out more about your ancestry. And those types of tests are not reviewed by the FDA. But some direct-to-consumer tests are FDA approved and do look for specific mutations that can increase risks. However, it is important to know that these tests are not comprehensive and should not be used for medical decision-making. Next slide, please. Importantly, a company that does direct-to-consumer testing is called 23andMe, and this specific company has been doing testing for BRCA1 and BRCA2. However, in the past, they have only been looking at 3 specific variants that were not common in individuals that were Black or Latino, but they were common in people that were of what we call Ashkenazi Jewish ancestry. But I have some exciting news for those that may already be a customer of 23andMe, that for Breast Cancer Awareness Month, I believe it will be today, that 23andMe will be notifying 20,000 of their customers that they have now looked at not just those 3 variants, but 41 more. And those 41 more variants that they are looking at are much more common in people of Black and Latino descent. And we do believe that there are 20,000 people that are going to be informed this week that they will have one of these variants for BRCA1 or 2. If that happens to you, your family members, or any friends of yours, please ask that they discuss that information with a healthcare provider and continue on with confirmatory genetic testing. As I stated before, this would not be appropriate information to act on for medical information. Additional counseling and testing is needed. And then I believe if we go to the next slide, this is another poll. So for this next poll, this is another true or false. Please respond to, is it true or false that genetic testing costs thousands of dollars and insurance won't usually pay for it? Yes, so 89% of you said false, and that is correct. This information is false, and it is a common misperception for many, but I do believe we have a much more well-informed audience today. But many people do believe that genetic testing costs thousands of dollars and is not covered by insurance. This is not true. In fact, genetic testing costs are covered by most health plans, and most people can get genetic testing for approximately $250 or less. And if that is not affordable, financial assistance is also often available. Additionally, for adult females with a strong family or personal history of a BRCA-related cancer, genetic counseling and hereditary cancer genetic testing are a preventive care benefit under the Affordable Care Act. Next slide. We're going to do another poll here. This is fun doing these polls, and I have a feeling that we have once again a 90% or more correct rate on this. But let's go ahead and do this true or false poll. If you test positive for an inherited mutation, you could lose your job or health insurance. True or false? Whoa, 100%. Yay, everyone. This is great. This is wonderful news. Wow. I have got to tell you that I have given this similar information for years, and I do not ever think I've seen 100% correct on this question. So that is wonderful news. That is everyone on this call is absolutely correct that information is false, but a very common misconception. But please know that there are federal and state laws that protect against discrimination by health plans or employers based on a risk for a hereditary cancer. Next slide, please. In fact, there is a federal law called GINA, which stands for the Genetic Information Non-Discrimination Act. This specific law prohibits employers from using genetic risk information in making decisions about employment. It also prohibits most health insurance companies from using genetic risk information in making decisions about insurance coverage. However, these laws do not apply to life insurance, disability insurance, or long-term care insurance, although some states may have additional protections for those type of insurances. And then next slide, I'm going to turn over to Pam or Dr. Ganschow to do the poll on this one.
Great. Okay. So we have one more poll left, guys. You guys are doing great. So last poll, if you test positive for an inherited mutation that's linked to an increased cancer risk, there's not much you can do about it. True or false? I bet you would get 100% on this. And we did it. All right, 100%. So that's correct. The answer is false. So people with increased cancer risk have access to many more advanced screening and prevention options for lots of different types of cancer. I think, it's important to know that having an inherited mutation increases your risk for some cancers, and different mutations are associated with different types of cancers, but it doesn't mean you're guaranteed to get cancer. And I think most importantly, people need to understand there are a lot of options for people to prevent cancer or to detect it at its earliest and most treatable stage. And so here, I know this is a little bit of a busy slide, but it just highlights, the importance of all the different risk reducing and screening strategies and the individualizing of those strategies that we can use if we know someone has a hereditary cancer mutation, or if they just have a strong family of history of cancer and they don't have a mutation. For those, our highest risk patients who carry a hereditary cancer mutation, they can consider having different types of prophylactic surgeries to prevent cancer. So in the case of a BRCA mutation, women are recommended to undergo an oophorectomy, or removal of their tubes and their ovaries, because they're at high risk for ovarian cancer and we don't have good screening strategies. And these risk reducing strategies like these can have up to an 80 or 90% risk reduction. So they can almost, completely reduce, not quite completely, but pretty close to, 90% is a pretty impressive number in medicine. There's not a lot that reduces your risk by 80 to 90%. And so prophylactic surgeries can help prevent different types of cancers. But in addition, not everybody has to undergo prophylactic surgery. So if, for example, a BRCA carrier who, is at elevated risk for breast cancer can consider things like MRIs and mammograms, and even chemoprevention to reduce their risk for breast cancer or to pick it up early. In addition, we often recommend that they start at early ages. So, for patients who carry BRCA mutations, we now recommend that, screening for breast cancer screening start at the age of 25 instead of in their 40s, so 15 years earlier. And so it's really important to identify these individuals, to give them that option to really start these screening tests at a much younger age. As I mentioned, even if you test negative, you have a strong family history and you test negative, we don't know all the mutations that cause cancer. And we're learning more and more about these mutations and ways to test for these mutations. And so, genetic testing is evolving. But if the test is negative for you and you still have a strong family history, we're going to recommend that you can consider earlier mammograms or more frequent mammograms. And if, colon cancer or, cancers associated with Lynch syndrome are running your family, we may recommend, earlier colonoscopies, or frequent colonoscopies, starting again in your 20s, and doing them every, 1 to 2 years instead of every 5 to 10 years. In addition, there are a lot of medications that can reduce the risk both for breast and for colon cancer, as much as 50%, which is pretty significant. And so these are things that your doctor can talk about, but again, it can really only take advantage of if you undergo genetic testing and you know your family history. Those are two important things that can really help guide decisions around individualized screening recommendations. So I'm just going to switch gears now. So I think we've talked a lot about, what genetic counseling and genetic testing is and the importance of it. But I really want to kind of come back to what we talked about, cancer shouldn't be a family secret anymore. And so it's really important to talk with your relatives about your family medical history. And to collect your family's health history, not just about cancer, but about other things, and share that information with your relatives and with your doctors and your providers. This isn't always easy. Some people and some families can be really private about their medical information, especially those in prior generations. And so some tips that can be helpful, and I would love if people want to share that during the discussion, tips that they've found helpful, but, really emphasizing how the important the information is and how in terms of the health of other family members. And so that, we need to overcome and we need to break down these secrets and really share what's happening in the family with the relatives. And sometimes finding the person in the family who really knows the most about the family stories often knows kind of what's hidden in those families and the family lore. And that's a really, really good place to start. But would love your tips from the audience about other things that you have found really helpful. The other thing is that, as you find out your family medical history and you share your information with relatives, this can be hard and you don't have to do it alone. And I think there's some really great resources that can help you. And here are two of them. There's a lot out here. I think if you Google family history and how to collect family history, you come up with a lot more. But I think two that we found really, really helpful is one of the CDC, the Center for Disease Control, has a tool called Let's Talk that guides you really through a conversation with your relatives about an inherited mutation in the family. And the other one is the Force. So Force is a wonderful organization that supports people who are living with an inherited mutation. And they've developed a brochure called The Genes Between Us. It's really a step-by-step guide to talking with relatives about their medical information and sharing your information with them. So I encourage you to look at those resources. There's QR codes if you want to use those. And then finally, I think that, there's also an easy way to find the resource that Deb is and that her team is and that are around across the nation. And that's genetic counselors. So they can really help you understand how to collect that family history and help interpret that information. So you can find a genetic counselor near you using the National Society of Genetic Counselors website. And this has a lookup tool. You can just put in your zip code and it pulls up all the genetic counselors that are in your area, and including those who can provide telehealth services, even if they're out of the area. And I just want to actually make a plug here. Deb's got an amazing program in genetic counseling at Northwestern, and there's several around the country. And for those of you who this is like, you feel that passion that you're hearing from Deb and I, we need a lot more genetic counselors out in around the country. So if anyone in the audience is sort of looking at career options, consider this one. It's a very rewarding option, and we need a lot of genetic counselors. Okay, so, now that you know about hereditary cancer, what can you do? Just sort of takeaways before I summarize. Just remember, collect your family history and share this information with your doctors and inquire about whether genetic testing is right for you. And seek out a genetic counselor if you need more information, or as like Deb said, if you don't feel like you're getting the right information from your providers. It was great to see in the poll how much information you all know, but providers are still learning this along the way too. So if you don't feel like you have a provider that knows a lot about genetic testing, please reach out and find a genetic counselor. They can help. They can help you tremendously, and there's a lot of resources out there. Well, can I go back? Yep. Okay. So I'm just going to wrap it up, and I'm excited to hear from Tasha about her experience, and then hear from the audience all of their questions. But just in summary, remember that what we learned today is that hereditary cancers are caused by inherited mutations that can be passed on from parents to their children, and that genetic testing can really help people learn if the cancers in their family are caused by an inherited mutation and if they may be at risk for certain types of cancers. Genetic counselors can help you decide if testing is right for you and help you and your relatives get genetic testing. And people with inherited mutations have a lot of options for preventing cancer or detecting it early. There's a lot of organizations that have resources to help you all understand what hereditary cancer is and help families understand that and make decisions about their care. And we'll leave you with that and pass it on to Tasha, who will tell us a little bit about her experience. Thank you.
All right, everyone, can we please give a virtual hand clap for Ms. Deborah Duquette and Dr. Pamela Fanshaw. Thank you, ladies, so much for sharing that information. Even I've learned some additional things, so thank you. And now I will introduce Ms. Tasha Weathersby, a proud resident of Chicago's vibrant South Side, is best known as the compassionate powerhouse behind the operations of Weathersby Wonder World Daycare Center. As the youngest of 9 children, Tasha's upbringing instilled in her a deep sense of community and the value of nurturing young minds. Her efforts extend beyond the walls of the daycare center as she serves as the esteemed founder and executive director of Wonder World Social Services, NFP, a pioneering organization dedicated to providing counseling and essential support to the youth and families of her beloved community. Outside of her professional accomplishments, Tasha embraces the joys and challenges of motherhood, taking on the role of nurturing mother to her 1-year-old daughter. Her experiences as a mother further fuel her dedication to ensuring that all children, including her own, have access to the resources and support necessary for their holistic development. With an unwavering commitment to making a difference, Tasha continues to inspire those around her, fostering a legacy of compassion, resilience, and empowerment for generations to come. Please give a virtual round of applause for Tasha.
Thank you so much. In remembrance of Chris-Tia Donaldson, founder of Thank God It's Natural, as her foundation continues to support and empower those in the battle against breast cancer, I want to thank you. It is indeed an honor. I extend my heartfelt gratitude to all the participants, including the dedicated breast cancer doctors, compassionate nurses, resilient survivors, and invaluable panelists. Your unwavering commitment and contribution have not only fostered a deeper understanding of this challenging disease, but have also instilled hope and resilience within our global community. Thank you. In 2005, I had half of my colon removed. I believe that was October 31st, 2005. I had half of my colon removed. So when October 31st, 2006 came, I was so happy. I was like, I made it. I'm a survivor. January 2007, I found the lump under my breast. And I really didn't know what it was. I never thought it was cancer. And by me having a daycare center, I had a parent who was a nurse. And I just, asked some simple questions like, well, I said, what does it mean if you have I felt like a little lump under my breast? And she said, oh, it's probably nothing. Are you on your cycle? She just asked me different questions because she was letting me know sometimes as women, when we have our cycles, sometimes we get little lumps. So she said, oh, no worries. Don't worry about that. You're fine. So I just went on day to day, maybe for about a week and a half. And so I mentioned it to my sister. And so when I told my sister, I'm like, I kind of felt a lump under my breast. And she got in panic mode, like, oh my God, you have to go to the doctor. So she kind of scared me. So I'm like, oh. And at the time, because as an African-American, I didn't have any resources because in 2005, I was about to sign for my insurance. They denied it. So when 2006 came, they said you have to at least wait a year later. I didn't really want to go to the doctor because if it was cancer, then I wouldn't be able to sign for insurance. And so it kind of held me off from going. And my sister, she had a godmother who had worked at some type of medical facility. And she explained to her my situation. And she said, well, what hospital has your sister been going to? So it was a medical community center, Heartland Outreach on the north side. And so I called them and I explained my situation. And they said, well, you know what, because of your medical family history, we're going to have you to see a midwife. So when I went for the appointment, the midwife, she gave me the examination. And afterwards, they just started having me fill all these papers out like, okay, we're going to help you. We're going to help you get insurance. And it still didn't dawn on me what was really going on. And so they set an appointment for me to get an ultrasound. When I went for the ultrasound, I remember the doctor, he just kept on looking at it. He kept saying, I don't like what I see. Now, in my mind, I'm saying, I don't care what you see because I don't have cancer. And he just continued to say, I don't like what I see. He said, now I'm going to give you these results in 3 days. The next day, I get a call saying, we have your results. So I'm saying, wow, this is really fast. Get in my car, I come down for the results. I'll go into this room, and the midwife comes in and she looks at me and said, we have your results, Miss Weathersby. And I said, okay. And she said, you have cancer. You have breast cancer. And I'm like, what? Breast cancer? And she said, are you okay? I said, I'm fine. And she said, well, did you come with anybody or did anyone ride with you? And I was like, no, she said, well, are you able to drive home? And I'm like, oh, I'm fine, I'm fine. So as I'm leaving out the building, now I'm from the south side of Chicago, I'm all the way on the north side. As soon as I walk out the door, and it's like the air hit me, and I was like, you have cancer. So I'm walking down the street, I'm just crying and, oh my God, uncontrollably. And so I get in my car and I call my oldest brother. He raised me like a father because my father passed when I was 19 months old. He had a heart attack. And so my brother at the time was a police officer and he worked on the north side. And I called him and I told him what it was. And he was like, no. He was like, I'm about to take off of work. You need me to come pick you up? So I said, no, I'm fine. So I'm in my car. I'm driving on Expressway. I'm crying. And something just hit me and said, call your church. I called my church. And one of the ladies began to pray for me. I felt a little better, but I'm still in shock. By the time I get home, I open up my door. All my family is there. And we've already lost, at the time, 3 siblings to cancer. The youngest was 8 years old. She had a tumor on the brain. I lost a sister that was 40 years old from breast cancer. I had another sister that was 32 years old, and we buried her the day before her birthday. And at this time, I was taking care of my brother who had prostate cancer. When I opened up that door, my family, they just hugged me and just was like, you got this. We love you. You're going to make it. At that time, I knew I had to fight. This is going to be a battle because I had already seen what it had done to my other siblings. I had a double mastectomy done, although I only had a lump in my right breast. I chose to get double mastectomy just to cut down my chances of it recurring again. I'll never forget, after surgery, I had a nurse to come to me and say, and I'm just waking up, and she said, aren't you gonna get your ovaries removed? And I'm like, what? My ovaries? Like, why would you say that? And she said, well, you know, it's kind of linked together with breast cancer and ovaries. And so I'm taking this in, but I'm still under medication. So later on, when I started taking my chemo, I did ask my doctor if I needed to get my ovaries removed. Although I got the double mastectomy, I thought that would cut my chances from not having chemo. So when I asked the doctor, I said, well, do I still have to have chemo? And the doctor said, yes. I started crying so hard. I boo-hooed. And the doctor said, Miss Weathersby, you didn't cry this hard when we took your breast. And you crying about your hair? I'm like, yes. I was like, I can't wear a wig. My head is too little for a wig. And he just fell out laughing. And it's just something about our hair. And I had to think about it. The nurse said, well, guess what? And I said, what? And I'm thinking she's going to say, you could take this pill. You could take something that'll stop it. She said, it's going to grow back. And it hit me like, right, it is going to grow back. I'm about to fight cancer. I got to put on some boxing gloves. I have to get ready and prepared. And I had to put in my mind that hair doesn't make me a woman. My breast doesn't make me a woman. If you take all of these away, I'm still a woman. And the battle what I had with the cancer, it was rough, it was tough, but I continued. I had to encourage myself. The first time after the first chemo treatment, I was brushing my teeth and I'm looking in the mirror at myself. And I noticed that the scales from my tongue was falling off. And it's like, what is this? And I began to cry like, you got cancer, you got, oh my God, you look at you. And I cried for about 30 seconds. And then I said, okay, that's enough for the pity party. You got this. You can do this. You can make it. And I began to surround myself around positive people. I didn't want to hear anything about somebody saying, oh, my family member died. Do you know this can happen to you? No, I put on a fight. I wanted to only be around positivity. And I began to speak those. Even if I didn't feel well, I began to say, I feel good. I am healed. You got this. And after my chemo treatments, I asked my oncologist again, should I get my ovaries removed? She said, well, before you do the drastic thing, because I had no children, she said, let's get the genetic testing done. I went to Cook County Hospital. They gave me the genetic test, and I still really didn't understand exactly what it was. I get a call from Cook County, and they said, we have your results, Ms. Weathersby, but we've never seen anything like this. You have a double gene, and I'm assuming it was in BRCA1 and BRCA2. So I said, oh, okay. They said, but we've never seen this. Can we document it? I said, okay, sure. Still not really understanding, but I knew that it gave me like over a 50% chance of having breast cancer, and I had it. And then for ovarian cancer, it was like over 45%. So I said, okay, I'm going to get my ovaries removed. Although I didn't understand it, I knew that portion of it would cut my wrist. I had a full hysterectomy. And later on, I began to do some advocacy with the University of Chicago. And I had maybe like 2 classes that I needed to graduate. And I went and I ended up doing getting my classes done in probably like a year. And so then I asked the University of Chicago, I said, well, what can I do to help? I want to help other women. I want to help other people to let them know you are not alone. You do not have to go through this by yourself. And she said, well, have you ever heard of an oncology social worker? And I'm like, no. She said, well, look it up. And I went back to get my master's at Chicago State University. And I take my exam to be a licensed clinical social worker December the 11th. And I am a foster mom of a 1-year-old and looking for adoption next year, hopefully next year. And next month she'll be 2 years old. And to let everyone know, live with no regrets. Don't ever say, I should have did this. I should have took this test, or I should have got this done. Just do it. And I just want to just touch on the basis of the importance, because even when I talked to my own family about the genetic testing, they wasn't really open to it. They was like, that's open up, that's opening up health issues, or, I said, just because you take a genetic test, it's not going to give you cancer, but they was thinking like, it's better not to know. And I'm like, sometimes if you don't know something, it can kill you. So we need to know, we need to talk about the genetic testing and the diseases and different ailments and health in our families. Because even now, when I think about it, my mom never talked about it, but my mom had a mastectomy, a double mastectomy, and I've seen it, and we never talked about it. It was never anything like that. And when she passed, it was, and she passed from kidney failure, but The family, we never discussed this. And right now, my oldest brother, who took care of me like a father, he just started his first chemo yesterday for colon cancer. And so it's important that, you know, because they always think, oh, I feel healthy, I don't have to do this. And my brother was in shape, police officer, 6th-degree black belt. And he felt like, I feel fine. I don't need to take no test. I'm fine. But it's important. And I believe that this could save lives, early detection, mammograms, screening. And it's important, especially in our African-American community, with the lack of resources. And that's why I'm here to help in any way I can. Let's beat this, knock it out.
Tasha, thank you so much for sharing your story. I kind of thank you so much. There are two things you said that I just wanted to quickly point out. You said, you know, you can take the hair, you can take my breast, and I'm still a woman. And when Chris-Tia was going through her journey, she said, cancer is just one storm. It didn't define me. So
Right.
as Chris-Tia is running a natural hair company,
Yes.
does not have any hair. So when you said that, it really stuck with me, like, wow, you know, your battle, my aunt's battle. So again, thank you for sharing that. And then you said, you know, in the Black community, it's not talked about. Our health, you know, it's like, it's very hush hush. If you don't know, you know, it's ignorance is bliss.
Yes.
So before we, you know, head over into the Q&A, I just want to stress the importance, especially in the Black and Brown community, have the conversation. Have the conversation. Knowledge is key. So thank you again.
Thank you all. Thank you.
We had someone with their hands raised. And Tarnika, I cannot, here we go, Miss Rosie. Miss Rosie, can you please, I'm gonna take you off of mute. Please share your question or comment.
Are there any research studies for genetic counseling available?
I'm sorry, Miss Rosie, we're having a little trouble hearing you. Can you repeat the question?
Are there any research studies for genetic counseling available right now?
Deb, I'm gonna yield the floor to you.
Yes, so I believe Rosie's question was, are there any research studies for genetic counseling right now? Yes, there are definitely quite a number of different studies going on for actually a variety of reasons. Many genetic counseling studies are going on, especially in the hereditary cancer space. And I would say pretty much at any major academic center, there is something going on with this realm. I can also tell you that a large amount of federal funds from both the National Institute of Health and from CDC, as well as other foundations, are going for this very important research topic, which has to do with genetic counseling and hereditary cancers. You can also go actually to Force's website. That website has on it a very great tool that you can put in specific information about yourself, and it will tell you what research studies are available for hereditary cancers. Another great website to know about is also called clinicaltrials.gov, and that has everything that has to do with federally funded clinical trials that are available.
Awesome. Thank you so much.
Thank you, Deb, and thank you, Miss Rosie, for your question. Did we have any other hands raised before I pop into the Q&A box?
We do. We have Lynn.
Right. All right, Lynn. Go ahead with your question, please.
It's actually a comment, just in honor of Chris-Tia. I was privileged enough to be her breast medical oncology nurse, and she was so wonderful, and we loved her so much. She just was amazing, amazing in her journey, and she just consistently amazed us. Whatever we asked her to do, she did it. She tried so hard, and this is really like an unbelievable experience for me personally, because to know her in that way and then to see what you all are doing in her honor, oh my gosh, I just know she has got to be so, so happy about all of this. So kudos to you, and thank you for doing it, because she's just one of those kind of people, leaves a lasting impression. And you knew she did great things before, and she's continuing to do great things now. And it's just such an honor to see all of you and hear all of this. So thank you.
Thank you so much, Lynn, for sharing that. Normally, I would just cut the camera and just have my session, but my cry session, but I'm gonna let the emotions flow. Thank you so much for sharing that. Chris-Tia fought hard. And again, thank you to the team at Northwestern. All righty. Any other hands raised? All right, so we are going to go to the box. I think we covered some of these questions. So we asked, was the genetic testing covered by insurance? And Deb gave some background to that. And are there any research studies for genetic counseling available? We answered that. We have another one. If your primary care physician refuses to refer you for genetic counseling, where can you get this done?
You want to take it, Dr. Ganschow? Yep.
Yeah. So I apologize on behalf of that primary care provider. I think that they are still learning a lot, and we're doing a lot in this space to educate providers and get them up to speed with this. It's historically not been something that's been part of training for primary care, and we need to change that. That being said, I think that some of the resources about finding a genetic counselor, so you can use that NSGC resource, and you can call a genetic counselor and get, and get an appointment with a genetic counselor. If your insurance requires you to have a referral, I would consider changing your primary care provider if you feel like there's information you're getting that's not right for you, right? Not every doctor's right for every patient is one of my first rules in medicine. And when I see patients in the clinical setting is you got to find that right mix. You got to find someone who's going to meet where you're at and give you a good understanding of why or why not they're, making these decisions for you, right? Everyone should have an option to do this. And if they don't meet criteria, they can pay out of pocket to have testing done. I don't know if Deb, if you want to expand upon that.
I think you answered it very well, Dr. Ganschow. And I'm for the person that asked that question, my heart goes out to you that you've perhaps had this conversation with your provider and perhaps not been heard for what you're saying and not had the appropriate action taken. So please, because there are so many, my heart's going out to so many people right now on this call. So please, if I can help you in any way, please contact me, okay? And I can be reached through my email at Northwestern, and I will help you navigate personally through this to make sure you get to the appropriate place wherever you might be in the world. I will make sure, okay? And genetic counselors are like that. I am not alone in this. Genetic counselors, if you find any genetic counselor, they're going to help you. Also, I think Tasha, patient navigators, social work cancer navigators are also another wonderful group to also tap into. But if you have not had cancer, if you're kind of like in that primary care setting and just don't know how to navigate that, please just go ahead and reach out to any genetic counselor. But myself personally, like I said, I feel just there's a lot of love here going on here in this webinar today. So please, if I can help in any way.
And just to piggyback off of Deb, ladies, gentlemen, everyone on here, listen to your body. If you're telling your primary care provider, hey, something doesn't feel right, seems off, and they're not listening to you, get another one. There are plenty out there. I know sometimes, picking primary care providers can be a task, a job in itself, but they're not listening to you. Get another one. So we have I have some questions for Deb and Dr. Ganschow. So how do you start the conversation with your family about the family medical history? Tasha and myself, kind of stated that in the Black and Brown community, it's kind of like a bad omen to start asking those questions and digging up those skeletons. So how do we approach this?
Dr. Ganschow, do you want me to go first and then you can
You
add?
go first and then I'll add. Yep.
Yeah. So this is something that has been worked on at the national level, believe it or not, since 2004 by the U.S. Surgeon General. So the U.S. Surgeon General, since 2004, has been promoting the importance of collecting and sharing your family health history information. So the U.S. Surgeon General, and now it's on the CDC, Center for Disease Control's website, a tool that's called My Family Health Portrait. And the My Family Health Portrait is a way that you can start having that conversation, discussing family history. Now, what's really interesting, and I would love everyone's thoughts about this too, is when this first came out, this campaign and this electronic tool that they've collected to collect your family health information, they promoted to do this coming for Thanksgiving. So in 2004, every Thanksgiving, there was a family health history campaign to please collect at Thanksgiving when people's families would be getting together to have this conversation and to collect that information. I would imagine, even though there's a very well versed audience here today, that many of you may have never heard of this Thanksgiving Family Health History campaign. And now the messaging is to please try to collect it at any time, not just Thanksgiving. And honestly, I believe Thanksgiving, even though it seemed it might be the most opportune time, may not be. But where has been very, very successful, and there's been some cool research done on this, but I've had the privilege of being part of this as well, is at family reunions. So at family reunions, when you're doing those big family reunions, have someone say, let's start to collect this information. And there's really fun ways that you can do this too, that make it more uplifting for a topic that could be somewhat scary. And Dr. Ganschow, do you want to add on more?
Yeah, no, I think that you nailed it, Deb. I'm really taking advantage of those family get-togethers, whether it's a birthday, whether it's a reunion, whether it's a holiday, or multiple ones. And then, as I mentioned earlier, like finding that person who kind of knows the family stories, right? They often know more, and starting with them, right? And then also, saying this might be hard, and I know we haven't talked about it, but this is important for the health of everyone in the family, right? And can really help everyone make decisions about their health and determine whether this is, whether genetic testing, and just even modifying their screening regimen, right? Even if aren't eligible for genetic testing, it impacts the screening regimens that we put forth as providers, that we recommend, that we discuss with our patients. So, just talking about the importance for overall family health and breaking down those secrets, I think are two things. But find that storyteller and then ask them who else to talk to. I think are two additional tips. And I would love to hear, if Tasha, you have any other thoughts on how to do that, or any other tricks that you've used. A lot of times just sharing a diagnosis with cancer, suddenly, people will start talking about it, right? So if there is a cancer diagnosis, you could even start with that, right? Like, hey, Tom or my brother had cancer, and I'm just wondering if anybody else had that, right? If you know of even one, that can sometimes be a good sort of way to open the door.
Tasha, did you want to add anything? Okay. All right. So find the family historian. Start asking those questions. Thank you. So we have another question from Maria Perez Franco, and she said, can you speak more to the resources and help the TGIN Foundation provides and how we can assist our patients in accessing them? So Dr. P, can you answer that, please?
Yes. So first of all, thank you all for having us today. appreciate the information and the sharing of knowledge. And TGIN is definitely here to support the initiatives. So in terms of the TGIN Foundation, you can find information on our website at www.tginfoundation.org. We are currently working on 3 initiatives right now. One is the Lyft partnership, where we partner with Lyft to provide free rides to breast health appointments, as well as we were doing COVID vaccinations. And then to date, we've provided over $23,000 in rides. So we want to continue to expand on that partnership. We also have another initiative called Pink Ambassadors, where we recruit ambassadors and creators to spread information about early detection and methods to mitigate the risk of breast cancer via social media. And last, but certainly not least, our partnership with Robert Lurie Comprehensive Cancer Center. We educate women on health disparities that Black women in Chicago experience in an effort to close the gap and empower women to be their best health advocate. So these are the 3 initiatives that TGIN Foundation are currently working on. As many of you know, ever since the COVID pandemic, it seems like it's so difficult for women to get breast health appointments. You know, you call now and try to get a mammogram. They're like, oh, it's 6 months out. It's a year out. And it's like, but you're telling me that I need to get these tests and these exams. So one of our initiatives that we're going to be working on soon for the TGIN Foundation is getting a boob bus. So we are currently in the process of researching a mobile mammogram bus, and instead of waiting on women or women having to wait to get to their breast health appointment, meeting them in the community where they are and helping them get those appointments and everything. So if anybody has any experience or anything, we're open, but that's one of our great visions that we have for the TGIN Foundation. And I think at the end of the presentation, we'll be popping up our graphic for our upcoming Cocktails for the Cure event to benefit the TGIN Foundation and to continue Chris-Tia's legacy.
Thank you, Dr. Piper. I'm so excited about this bus.
Yes.
Drive it, please. Yes. Do we have any other questions? We have a few minutes left. I believe we do a time check. We have 12 minutes left. All right.
Just make a comment about the, I think a really important point about access to breast health services, right? Post-COVID, the wait time for mammography is really long, and it varies by institution. So if you're calling and trying to get an appointment somewhere and you can't get in, call around. There's, different institutions have different variability, but also just make sure that you're, getting good quality mammography. I think a lot of institutions around Chicago have really, worked to improve the quality. Look for, the ACR accreditation, and BICO accreditation can help you find those highest quality facilities to get your mammogram.
And I'm just going to say one more thing too. Just once again, I'm in a good mood, really good mood today. This has just lifted my spirits up. So Dr. P, I would like to tell you that when this boob bus comes, please let me know, and I will make sure that we will put genetic counselors on that boob bus to bring the genetic counseling so people don't have to try to get this access in many different ways. We will make it happen, okay? I will call upon my workforce here and we will get you that. So
thank you so much. I appreciate that.
This is beautiful. Are there any other questions, comments before we wrap it up? All righty. Well, I just want to thank you all for joining. Thank you for your time today. And I really hope you learned something. I know I did. If you all have any questions or comments, Tarnika is going to have the information sent via email for the panelists. And we look forward to keeping in touch.
We did have one question that came through via email to me.
Okay.
Someone asked, Eris, what is your skincare routine because you look gorgeous. TGIN should make skin products.
A liter, well, I'm a little bit behind today, but 1.5 liters of water every day. And Dr. Kiehl's since what is it, 18 something? That's what I use. But thank you. TGIN come with a skincare line. Dr. P, write that down. All right, and this is our event. I'll just briefly give you a background of the Cocktails for the Cure gala that we have every year. In 2017, after Chris-Tia had finished her first round of chemo and kind of got back into work, she said, you know what, I want to give back. So I'm going to put on an event to raise funds and raise awareness so I can, tell my story. This event was at a small bar and it was probably about 30 people. The following year, we had about 100 people, and each year it has grown. So this Cocktails for the Cure was really her way of giving back to the community. So Dr. Piper and I are so excited to continue Chris-Tia's legacy. Our goal this year is to raise $100,000, and we are almost there. But we would really love to see you all at the Cocktails for the Cure fundraiser. It is from 6 to 10 p.m. next Saturday at the old post office, right next to the new post office downtown. All righty.
And we can let them know that we have special guests also. Audrina Sinclair. She will be our special guest host. We also have the Silver Fox Squad, if you ladies know. If not, go to Instagram and look that up. But the Silver Fox Squad is a special guest, as well as sounds by DJ LMS. We have a great panel discussion, and we'll also be honoring a breast cancer survivor, a Chicago fashionista, Barbara Bates. So get your tickets. They're going fast. It's going to be a good time. Our theme is Casino Royale. So we'll have, charity table games, signature cocktails, a great menu from Blue Plate, and just a great time for a great cause. So we hope you can make it out.
All right. Thank you for that information. And again, to our participants, panelists, and our audience, thank you so much for your time today, for joining the Chris-Tia Donaldson Breast Cancer Equity Symposium. Bye, everyone.
Well,
Thank you so much.
Thank you.
Thank you.
Bye-bye.